Hi, everyone. The topic of our project was combating childhood obesity. The reason we picked this topic was based upon our reflection of our childhoods. We realized as children, we assumed we were eating healthy because we were eating at home, as opposed to fast food restaurants. But this wasn't necessarily true since many cultures consume heavy carb diets. We wanted to do something memorable for our audience to help them live healthier lifestyles and help them make healthier food choices. The idea of our project was to increase healthy eating and promote exercise in an effort to reduce childhood obesity. The problem we addressed in this project, again, was childhood obesity, and this was because 13.7 million individuals between the ages of 2 to 19 are considered obese. And of these 13.7 million individuals, Hispanics are more likely to be obese than non-Hispanic whites, predisposing them to chronic conditions in adulthood, such as hypertension and diabetes. Our target group was fourth and fifth graders. The reason we picked this group was because there's a spike in childhood obesity in this age group, and so that we can intervene early and break bad eating habits and educate on good nutrition so they can carry healthier habits with them into adulthood. We also focus on a lower socioeconomic community because they have higher prevalence of obesity in those communities. And we focused on a community that was predominantly Hispanic based because statistics show us that these communities have a higher rate of obesity.
And using the LAC DHS SPA data, we chose SPA 7 and the city of Maywood because there is a significant percentage of children in grades 5, 7, and 9 who are obese at 26%. And as mentioned earlier, childhood obesity is a problem in the lower socioeconomic areas for various reasons. And using objectives under nutrition and weight status and physical activity from Healthy People 2020, we were able to gather information about the importance and benefits of healthy eating and maintaining an active lifestyle. Our needs assessment proves to show that childhood obesity is a problem. The majority of responses came from Hispanic females who had children attending Loma Vista Elementary School. And 100% stated obesity does increase a child's risk of other health problems such as heart disease, diabetes, and hypertension. 46% agreed that childhood obesity is a problem in their community, and 58% said that children participated in 0 to 2 hours of physical activity. And 50% strongly agreed that only one way to reduce childhood obesity is to increase nutrition, education, and encourage physical activity. With that information and research from our systematic reviews, we showed childhood obesity as a complex problem with no easy fixes. Various articles mention using school-based interventions with the multi-component approach, such as eating healthier snacks and beverages and physical activity. But the best interventions not only incorporated the schools, but also the community. And we also wanted to tackle on the issue of sugary beverages because evidence showed that there is a 60% increase in calories consumed by children ages 6 to 11 from 1989 to 2008. Another study showed that school grade students are receptive to information regarding healthy habits, which was another reason we targeted fourth and fifth graders.
For our intervention, we began by introducing ourselves and telling the kids about the PA profession. We then decided to divide our presentation into sections, and after each section, we had an activity to reinforce the retention of information. The first section consisted of My Plate, where we showcased the appropriate quantity of each macronutrient in their diet. That included protein, carbohydrate, and fat. We also pointed to the better versions of carbohydrates, highlighting the importance of choosing whole grain groups instead of processed foods. The next section was designed to teach them about sugar content. We decided to do this by utilizing popular drinks. We pointed out the nutritional fact information on the back, and we asked them to translate that number into tablespoons. The third section consisted of the consequences of unhealthy eating with a focus on diabetes, cholesterol, and obesity. Lastly, we demonstrated how exercise can be fun by hosting a Zumba session in which the majority of kids were happy to participate. At the end of our intervention, we offered water and oranges from a local tree. In fact, my mom picked these oranges, which made it very meaningful for them, and they were happy to get them. This also modeled how to snack properly after a workout.
We made the intervention with a few things in mind. The first was health literacy. In general, Americans read at a 5th grade level. This aligned very well with our presentation because 5th graders were included in our audience. We used pictures, videos, short sentences, white space, mug readability formula, and the teach back method to ensure that the students retained the information well. The second thing that we used was we incorporated the cultural competence. We included culturally appropriate foods that capture their attention. We took surveys of popular snacks and beverages that 5th and 4th graders enjoy. Also, 6 out of 7 of the presenters came from a diverse Hispanic background, which also helped add more culturally relative material. We also took in consideration advocacy. We advocated for the students to implement healthy habits in their daily routines. Our intention was to, in turn, positively affect the community, one family at a time. We also encouraged them to take control and that they have the power to improve their lives.
When it came to creating our pre and post tests, what we really wanted to assess was what they already knew going into the presentation, and then being able to measure what they learned during. What we wanted to know was, could they identify healthy foods versus unhealthy? Did they know the recommended size of fruits and vegetables? Do they know how to identify how much sugar is in a beverage, and do they know where to locate it on the nutrition label? Could they identify some cardiovascular exercises and how much is recommended daily? And also, are they aware of the potential health problems that are influenced by unhealthy eating habits? So we did this by asking 7 questions that were written at a 4th grade level. We included pictures and had them answer in a multiple choice, circle your answer style format. And they were administered by their teacher in the classroom right before and right after the presentation. We also included 3 additional questions in the post-test that were for us to get some feedback. So for our results, for the next few slides, we have listed the pre-test data on the left and the post-test data on the right for comparison. The biggest thing that impacted our results is the number of tests we received back from the school. For pre-test, we got approximately 180 responses, and for the post-tests, we only received about 86. With such a big difference, we believe that a few classrooms had been missed when the tests were collected from the teachers for us. You will also see a slight variation in the amount of responses from question to question on each test, which we probably attributed to the students skipping over certain questions, maybe because they didn't know the answer or just somehow they missed it. In analyzing our data, out of the 7 questions we asked, 3 questions showed significant increase in the percentage of answered correct. The other 4 questions, there was very minimal change, and there was already a very high percentage of students that knew the correct answer going into the pretest. Health problems. So when looking at some health problems that can happen to your body if you don't eat healthy, this was one of them that we saw a significant increase. Majority of students knew that diabetes was associated. However, we saw an increase in the overweight and high cholesterol answers. High cholesterol going from 48% to 80%. The next one we saw was in the how many servings of fruits and vegetables should you be eating per day. We saw that the percentage went from 32% up to 90%, which was very significant. And then lastly, we saw when we asked how many minutes of exercise should they be doing per day, the increase percentage was from 68% up to 83%. On the post-test, we also asked for feedbacks from our students. We asked, do you think the presentation was easy to understand? And will you try what you learned today at home? 96% agreed. We also had one free response where we asked, is there anything else you wish you would have learned today? We posted the responses here for you to read. Majority said no, that they really enjoyed the presentation. They learned a lot. However, with the yeses that we did get, they kind of all followed along the same 3 or 4 topics. They all were asking for more information on things that we had presented on, such as how to make more healthy snacks and what healthy fruits could you mix together. They also wanted to know more unhealthy foods and how often they should and shouldn't be eating them. And then asked also to have more information regarding other health problems.
So from the moment we first met Ms. Hernandez, we realized that our intervention would be greatly beneficial to Loma Vista Elementary. She did mention in our first meeting that they currently did not have any nutritional education programs at the school. And this same enthusiasm that she had was evident with her 4th and 5th graders the day of the assembly. And in SPA 7 specifically, the impact is what mattered most, as that SPA reports a 26% rate of childhood obesity, specifically in grades 5, 7, and 9. Secondly, choosing to incorporate Zumba in our intervention was really a hit. We were able to connect with our 4th and 5th grade audience by being culturally aware of their interests. This was certainly evident from the responses we got from both the students and the teachers, including the little things like the song choices we chose to incorporate in the Zumba session. We even got notified that one of the teachers was one of the best assemblies they've had in her 20 years of teaching. And they're even now considering bringing back Zumba sessions at the school, which is really rewarding for us to hear as we realize just how great of an impact we made that day. After collecting the data, wish we could have made the pre and post tests a little more challenging. I think we were worried that the questions would be too difficult, but as we were inputting the data, we realized that a lot of the students were getting the answers correct in the pre-test, which didn't leave much improvement for the post-test. We also wish we would have had more time to fundraise because we would have been able to provide students with an actual handout they could have taken home to share with their families. And lastly, we wish we would have had more time. The students did mention that they would have liked to learn more about physical activity education, but again, it was all down to the time that we had.
So for our call to action, as Sonali previously mentioned, obesity is very prevalent at 18.5% in our population, with over 13.7 million children and adolescents affected. So no matter where you go into practice, there's really no avoiding it. You're bound to come into contact with a child or an adolescent who suffers with obesity, whether you're working in pediatrics or in the emergency room or even in a surgical setting. Therefore, we urge you, when you do have these patient interactions, to advocate for healthy habits. It's very easy to get nutrition sheets, even if you go to choosemyplate.gov. As you can see here, they give you free templates that you can easily print out and even have the children draw in so that they can learn more about portion control. Something so easy you can do as well is bring in measuring cups or even teaspoons, tablespoons, and show them how much sugar is in the drinks they're consuming. As we saw in our presentation, that is very impactful. And also just overall increasing the rate of follow-up that you have for these children suffering from obesity. We saw in our presentation that fun can really have a lasting impact, and we encourage you all to incorporate these fun activities in your everyday interactions with patients to really make a lasting impact. So sometimes it's very difficult, especially when we only have 15 minutes to be with our patients, to really provide them with not only the history taking, the physical, and provide them with education. So we encourage you to expand on a larger scale and reach out to your community, maybe by creating monthly clinic meetings where you invite a lot of your pediatric patients and their families or other members of the community to come and where you can host a meeting where you educate them. We discussed at the end of our presentation how much fun we had at Loma Vista Elementary, that we would consider taking this as a full-time job where we go to different elementary schools and actually present. So why not do this in the future as colleagues in our clinics and team up with local elementary schools, middle schools, and continue to be health advocates. And that concludes our presentation today. Thank you so much for joining us in our TED Talk. I hope you enjoyed it.